Ladies and gentlemen, this is our solution to the VA Care Coordination Challenge, CAREDINATOR. A key challenge is coordinating care among millions of complex clients. We used a previously developed conceptual framework to offer a structured patient goal-driven solution for care coordination challenges. To help resolve the existing care coordination challenges, our group has developed a generalizable methodological approach and prototype solution called CAREDINATOR to address care coordination issues among veterans with multiple chronic conditions. On the patient summary screen, a small CAREDINATOR applet window presents a summary of patients' care coordination progress and alerts, when appropriate. The next screen, CAREDINATOR Home, presents an expanded overview of the care coordination activities. CAREDINATOR summarizes areas, including discrepancies, gaps, and redundancies, that need the clinician's attention. These issues are identified using structured and free text clinical data that is analyzed by our natural language processing engine and then passed through a set of decision support rules. The care coordinator can reconcile the recommendations by keeping the relevant recommendation and adding it to a list of shared goals, defined as agreed on, and desired actions to achieve the patient's goals, or sending an instant message to the involved clinicians when clarifications or specifications are needed. CAREDINATOR's third screen, Goal Harmonization, assists creating these shared goals. Patient goals with domains identified in a pilot study for this project are recorded by the clinician. Under that, relevant care team goals are presented. These are extracted from structured and free text data using our analytics engine. Care team goals can be removed or moved to the list of shared goals, ideally through a discussion with the patient and after a mutual agreement. Each shared goal has a specification, an entity responsible for achieving this goal, including the patient, an evaluation timeframe for initiation of alerts when an evaluation is needed, and an evaluator who evaluates the progress towards the shared goal by a specific mode of evaluation. Shared goals can be added directly in the Shared Goals menu and can be updated or changed when appropriate. Any goal can be deleted at any time with identification of the reason for deletion. The Goal History menu captures all of the goal-related activities and enables easy restoration of any relevant goals or activities. Next, we will present a case study. John was honorably discharged from the Army in 1996 and is currently retired. He has a personal history of hyperlipidemia and chronic kidney disease. About a month ago, John complained about burning pain in his left shoulder and was diagnosed and hospitalized with a myocardial infarction and heart failure. After hospital discharge, John was assigned to the high risk for readmission population, given his new heart conditions and potential social support issues. Care coordinator, Matt, received a referral to help coordinate care for John. He invited John to an initial in-person meeting to review care plan activities and harmonize them with John's goals. Hello, John. Great to see you. I'm Matt, a registered nurse, and I'll be assisting you with achieving your health and wellness related goals.
Great. Looking forward to it.
So the first step for us is to try to better understand what your goals are. They could be anything related to your health or wellness.
I want to get better in general.
Okay.
One particular thing is being able to walk to the second floor of my house without shortness of breath.
All right.
I also really hate getting up 3 times in the night to go to the bathroom because of this recently prescribed diuretic Lasix.
All right. Okay, thank you, John. I've got your goals now, and we'll try to understand what the clinical team can do to help you achieve them. First, we'll need to try to keep your blood pressure under 140/90, according to your cardiologist, the most recent guidelines from the American Heart Association, and the VA kidney disease recommendations.
Okay, I'm ready to do that.
Great. Let's create a shared goal for this. And say that you'll talk to your primary care provider, Dr. Miller, about possible strategies to achieve this goal. I'll evaluate our progress on your blood pressure levels quarterly by looking over the blood pressure levels. We'll need to keep your blood pressure in a normal range to achieve your goals of improved health and unpleasant symptom reduction. Next, there's a strong recommendation from your cardiologist and the American Heart Association and the VA that you engage in a regular physical activity. Do you play any sports or other activities now?
I'm willing to do that, but I'm not really sure how intense this should be with my new heart condition.
Right, so this is not specified in the guidelines either. I'd like you to visit a physical therapist, Michael Anderson, so he can specify the best exercise regimen for you. I'll send you a link to Michael's availability so you can schedule your visit online. We'll discuss your progress quarterly. Regular exercise will help you achieve your goals of getting stronger and having less symptoms. We'll discuss the recommendations at our next meeting, and I'll also send Michael a message asking him to provide you instructions on the best exercise regimen for you.
Okay.
Additionally, the system suggests that based on the guidelines, you might be missing this blood pressure medication, a beta blocker. I'll add this to our list so your primary care provider can consider this recommendation when you next meet. One more set of recommendations from the guidelines and your cardiologist is about weight management and dietary salt restriction. For those, I would really like you to see our excellent dietitian, Jen White. I'll send you a link to her availability as well so you can schedule your visit online, and we'll review her recommendations next time. These diet recommendations are also going to be very helpful for you to achieve your goals of getting stronger and having fewer symptoms. About 1 month after John's visit, the care coordinator received several alerts about John's recent consult visits. Using its natural language processing algorithms, CAREDINATOR identified gaps that highlighted an unaddressed lack of social support. The care coordinator initiated a phone conversation with John where he referred to him to the social worker, Andrew Lopez, to help John identify resources that might help him with his wife. In addition, CAREDINATOR's natural language system detects discrepancy in the frequency of weight measurement between the dietitian and the MD. The care coordinator sent a message to the MD and the dietitian to reconcile the discrepancy. The care coordinator decided to schedule a follow-up visit with John to discuss these issues and other consultants' recommendations in 2 months. Thank you for this exciting opportunity to tackle care coordination challenges. Please reach out to us if you have any questions.